Hello, and thank you for joining us for Building a Behavioral Health Strategy for the New World of Work. This program is part of the SHRM webcast series. You can learn about upcoming and on-demand events from our e-newsletter and the webcast homepage at shrm.org/webcast. SHRM thanks Unum for sponsoring this program and SHRM's series of free webcasts for the HR community. Now some information about today's program. The pandemic has accelerated an already growing priority of behavioral health in the workplace. This program will explore how, as organizations pivot in response to new developments, they can best support the mental health of their employees now and in the future. To lead our program, we're pleased to introduce Dr. Arthur C. Evans from the American Psychological Association, Dr. Andrew T. Mueller from MaineHealth, and Swapnil Prabha from Unum. Here is some background on our speakers. Arthur Evans, Jr., Ph.D., is CEO of the American Psychological Association, the leading scientific and professional organization representing psychology in the United States. With more than 121,000 researchers, educators, clinicians, consultants, and students as members, APA promotes and disseminates psychological knowledge to benefit society and improve lives. Before joining the APA team in March of 2017, Dr. Evans spent 12 years as Commissioner of Philadelphia's Department of Behavioral and Intellectual Disability Services, leading the transformation of that agency's approach to serving a wide range of individuals with complex needs. Andrew Mueller, MD, is Chief Executive Officer of MaineHealth, a not-for-profit integrated health system consisting of 9 local hospital systems, a comprehensive behavioral health care network, diagnostic services, home health agencies, and 1,700 employed and independent physicians. With more than 22,000 employees, MaineHealth is the largest health system in northern New England, serving 1.1 million residents in Maine and New Hampshire. Prior to joining MaineHealth in 2021, Dr. Mueller served as President and Chief Executive Officer of Centra Health in Lynchburg, Virginia, and previously as President of Novant Health's Greater Charlotte market. His innovative and compassionate approach to leadership draws on his breadth and depth of experience as a practicing physician, a physician executive, and a veteran. Swapnil Prabha is Vice President of Digital Offerings at Unum. She has 15 years of experience in the insurance industry. Prior to joining Unum, Ms. Prabha spent 7 years at McKinsey & Company, where she was a leader in the insurance practice focused on digital services across all lines of business and employee benefits specifically. With introductions complete, I'm pleased now to turn the webcast microphone over to our first speaker, Swapnil Prabha.
Thank you, Mike. It's such a pleasure to be here today to spend at least 1 hour today talking about mental health. And the plan for that 1 hour is we will start out with Dr. Evans talking about his views on the current state of mental health in the U.S. workforce. We will then go to Dr. Mueller to talk about his perspectives as MaineHealth CEO, the challenges that the pandemic has brought to that organization and how they're supporting their employees. And then we'll round out by talking about behavioral health strategy and how can organizations think about building one, what are some of the best practices, et cetera. And of course, we'll have some time at the end for Q&A. With that, before I actually hand it off to Dr. Evans here, would love to engage the audience on a quick poll, and I believe I'm kicking it off right now. The question is, what is the biggest behavioral health, mental health challenge in your company right now? And you have 5 options here. Would love for you to take just a few seconds and pick the one that is most relevant for you. And as we wait here, I certainly, when I was reading through the question, was hoping that there would be a 6th option, all of the above, but would love to ask some of my fellow presenters to opine on what do they think would be the biggest behavioral health challenge that a company might face. And maybe we start with you, Dr. Evans.
If I might mute there. I think that the biggest issue is that employees, the workforce, is under a lot of stress right now, and I think there's an increased likelihood that they're going to see their workers experience burnout and not be able to be productive and not have good health.
Dr. Mueller, anything from MaineHealth that you would add if you were to answer this question, other than
I think
to pick one?
Yeah, no, I agree with you. I would probably pick all the above, but short of that, I agree completely with Dr. Evans. I think burnout is probably the biggest challenge that we're going to face, and certainly I think ultimately leads to some of those other issues that are mentioned in the question.
Absolutely. And I see we are getting about 70% responses are in, so maybe waiting for a few more. Okay, so with that, we are seeing increased burnout among staff. So lots of folks agreeing with essentially the presenters that that is something that stands out. Not surprising, perhaps, given the 18 months that we're having. Lots going on in the world right now, even beyond the pandemic. Disengaged employees, increased absences, underutilization of mental benefits, fairly even distribution, with high mental health related healthcare costs being at the bottom, which is in some ways great that we're not focusing on that right now, given the need is so high that we really need to be focusing on how we support our employees. And also in a weird way, perhaps a little disappointing that not enough utilization is happening of mental health resources, that is showing up on the radar. So with that, maybe I will hand it off to Dr. Evans to go to his section.
Well, thank you. So what I want to cover in the time that I have is try to give you a sense of what's happening to the workforce, to the nation's workforce right now, and what that looks like, and then suggest some things that we can begin thinking about, or a way of thinking about how we can approach that. The first big takeaway here is that Americans and our workforce, our employees, are stressed. Your employees are experiencing a lot of stress. We know that about 79% of employees say that they've experienced at least some work-related stress in the past month. But it's a much more complex picture than that, because when you look at other surveys that have been done, other types of information that we have available to us about how people are doing, it paints a really bleak picture of the impact that the pandemic has had on people's mental health. We know, for example, that 3 to 4 that people are reporting symptoms like anxiety or symptoms consistent with anxiety or depression at a rate that's 3 to 4 times what it was before the pandemic. Our Stress in America survey, the American Psychological Association Stress in America survey, which we do each year, but we've done on a quarterly basis throughout the pandemic, shows that what happened after the pandemic is that there was a spike in stress levels and that they stayed pretty high throughout the pandemic. We know that people are experiencing the impact of this chronic stress in lots of different ways. We know, for example, that about 60% of the population is experiencing unwanted weight changes. About 40% of those folks saying that they've had weight gain, and about 20% saying that they've had unwanted weight loss. We know that more people are drinking to cope with their stress related to the pandemic. That's what they report. We know that there are increased overdose deaths, and that children are going to the emergency department in psychological distress in much greater numbers than they were before the pandemic. Those are just some of the data that we that are reinforcing this idea that people are experiencing much higher levels of stress. And when we look at what are the causes of that, what we see is that the causes that we saw before the pandemic are the same causes, but more people are reporting that they are experiencing stress from these issues. Low salaries being 56% now saying that low salaries is a cause of stress. The workload being too heavy and unrealistic job expectations. All of those have increased over the course of the pandemic, along with lack of participation in decision-making, problems with my supervisor, and problems with my coworkers. People are reporting those at a much higher rate than they were before the pandemic. Now, we don't really know why that is exactly. It could be because there is just more stress related to these issues in the workplace, but it could also be what I mentioned earlier, which is all of us are experiencing higher levels of stress and just may be more sensitive to these issues. Either way, it's important for you to know as HR professionals, as leaders in your organization, that these are the things that are leading to stress and that people are experiencing these in ways that can be problematic. We know that roughly 6 in 10 workers say that they have experienced negative impacts of work-related stress. So what kinds of things are people reporting as being related to the stress that they are experiencing? A lack of interest. 26% of people say that one of the impacts of this stress is that they have a lack of interest or motivation or energy in their work. Difficulty focusing. And in fact, we just did another iteration of our Stress in America survey, and one of the big findings is that people have this a little bit of this fog. It's harder to make decisions. You know, most of us who've been working really hard throughout the pandemic can relate to this, that making decisions, the cognitive load that we have, our ability to concentrate and focus is impacted by the stressors that we're experiencing. The lack of effort at work is another outcome that we're seeing. But the point is, the impact, one, that we're having these stressors, that it is having an impact on us, and it's also having an impact on the work that we're doing. But here's the big takeaway that I really like for people to understand, that the people in your workplace who are reporting that they are stressed are much more likely, more than 3 times more likely, to seek outside employment than people who are saying they're not experiencing stress. And in a tight labor market where we have lots of people who are resigning, lots of people who are not returning to the work, it's much harder to recruit people in this labor market. It is really important for organizations to be able to hold on to and retain their employees. And one of the biggest drivers now of people leaving your organization is the stress that they are experiencing. So that imperative of what are we going to do about that, that's what we're going to talk about today. But let me just add another dimension to this. One of the things to understand is that your workforce is not a monolith, and that different parts of your workforce are going to be and are experiencing these issues differently. We know, for example, that communities of color report generally that they are much more likely to seek outside employment as a result of the stressors that they're experiencing. Members of the LGBTQ community are more likely than people who are not from the LGBT community to be seeking outside employment. People with disabilities and people who have experienced or witnessed discrimination are all much more likely to be seeking outside employment. And the implication of that is, as you're thinking about your interventions, you need to think about different subsets within your organization and how you can target specific interventions for those different subgroups. So I want to leave you with just a framework as we start to think about, well, what are some of the solutions to this? And one of the things that we do at the American Psychological Association each year is an award program called Psychologically Healthy Workplaces. And it's based on the science in organizational science and what we know about what is related to good organizational performance, as well as the factors that are related to employee well-being. And so five domains that we look at and we know are related to good, healthy psychological workplaces. And we know that organizations that have these kinds of workplaces are more likely to have employees who are experiencing higher rates and higher levels of well-being, but also, and importantly, those organizations also do better than their peers in various metrics of organizational functioning, like retention, their ability to perform their mission. So those five dimensions are employee involvement, organizations that pay attention to and are intentional about employee involvement and engagement, are more likely to have psychologically healthy workplaces, work-life integration, employee growth and development, organizations that focus on that, organizations that focus on health and safety, and organizations that have intentional employee recognition programs. Undergirding all of that is good communication. And so as you're thinking about interventions, I'd like for you to think about two parallel tracks. One is, what is it that you are doing for your individuals in the workplace? That's making sure that you have a good EAP program, that individuals in your workforce have access to good behavioral health care, ensuring that there is parity in your program so that people don't have differential co-pays or other kinds of characteristics in terms of being able to access their behavioral health benefit. Making sure that the network is adequate for behavioral health services. It is completely unacceptable that if you or your child or your family member needs access to mental health care, that you have to wait sometimes 2 or 3 months before you can see someone. That would be totally unacceptable if we were talking about a physical illness, and organizations have to take the same kind of urgency around resolving those issues for access to behavioral health issues. And then one other area that I think is really important, not only should people have immediate access or comparable access to the physical, as they would to the physical health services, but we should make sure that they have a continuum of services, not just outpatient. So for example, if you have employees that need residential substance use treatment because they need that break in order to successfully get their substance use issues under control, you want to make sure that that's available and that will be paid for by your insurance plan. So that's at the individual level. But there are also things that you can do at the organizational level, and that's where the psychologically healthy workplace work comes in, where we're being very intentional, or you're being very intentional about addressing these issues so that it reduces the likelihood that people are going to have problems, and you're creating an environment that is going to be much more supportive of people. The point here is that your environments, your organizational environments, can lead to stress, or they can lead to decreasing that stress on people and creating more support. So with that, I'm going to stop and turn it over to my colleagues.
Thank you. Thank you, Arthur. We have another audience participation moment here. Would love to get your vote on one of these. For what solutions or steps are you adopting to support your employees? and this is in the context of mental health. So what solutions or steps are you adopting to support your employees with their mental health needs? And it would be great to, again, as we wait for our audience to vote on these options, this time I would love to start with Dr. Mueller, you. Any of these specifically resonate? I know you're about to talk about your strategy in just a moment. Any one of these that specifically resonate with you?
Yeah, I think one of the ones that's really important for us is addressing stigma and culture. Believe it or not, as a healthcare organization, I think many of our care team members, many of our physicians and nurses believe that it's their responsibility to toughen up and suck it up during tough times without really understanding the impact that has not only on themselves, but also the individuals they want to care for. And so we've been having increasing conversations around the fact that we all are going to struggle from time to time, and that it's not uncommon, and that it's okay. And what's important is during those tough times that you reach out for help and make sure that you get the services you need so you can continue to be helpful to those that you want to care for and get back to doing the things that you love.
That is so important, and almost, I'm biased here, but it is very important, because if you can address that, you could argue that a lot of the other things, that resources that you provide, et cetera, will actually get utilized. It's very important. Dr. Evans, would you like to add?
Well, you all said the same thing that I would say. We're in a lot of agreement here. I do think it's creating an environment where these issues are understood, and I think the leaders of organizations, this is so important that leaders set the tone that these are acceptable issues, or these are issues that we should be paying attention to. I think Dr. Mueller is exactly right. And one of the things I try to do as a CEO is make sure that we signal very strongly that these issues are as important as people's physical health, and that as an organization, we want to be supportive to people. And as you say, if you do that, then it really enables a lot of other things to happen within the organization.
Excellent. And let's see what the audience is saying over here. A lot around the winner is the increased education and resources available, in line with what we've been talking about, addressing stigma. Culture is up there, dedicated time off, and then increasing accessibility to traditional care. Little surprised to see the increasing accessibility to digital support tools still being at the bottom, and we'll certainly talk a lot more about that when we talk about strategy at the end. But for that, very excited to hand it off to Dr. Mueller to talk about MaineHealth experiences and what are they doing with supporting their employees' mental health.
Yeah, Swapnil, thank you so much. And it's good to be with all of you this afternoon. And I'll tell you, it is something that is certainly hitting us all right now, and it really is impacting our workforce. And clearly, we've got a whole lot of things that have sort of come together to create a crisis situation, and that includes certainly the pandemic. It includes an increasing workforce shortage in healthcare, and some of that has only been increased because of the toll that burnout and other things have taken on our workforce. And we are seeing absolutely unprecedented demand for emergency and hospital services. And while you may not have seen the increased costs of behavioral health services for your employees yet based on the first survey question, Dr. Evans is completely and utterly correct. You are going to see increased costs in your non-behavioral health healthcare costs, because what we are beginning to see is not only pent-up demand for care that was delayed during the height of the pandemic. We are seeing without question part of what is driving this unprecedented demand for these services are the physical manifestations of the stress of the pandemic, which means more heart attacks, more strokes, more abdominal pain, more headaches, more backache, that are ultimately related to the behavioral health components of the impact of the last 2 years on a population. And so I am very upfront in stating that as a medical student and resident, I did not enjoy my psychiatry rotations. I convinced myself that I would not practice. I would just really stick to the non-behavioral health matters, and then quickly began to realize as a young physician that 70% of what I did as a family physician was behavioral health. Everything, it is all behavioral health. Everything we do is behavioral health. It is the one organ that connects with every other part of the body, which is why this is so important to your employees, because they're all feeling and experiencing this in the moment. And we have great data from veterans in Afghanistan that show that when they were in firefights and exposed to incredibly stressful circumstances, they began to experience, again, the behavioral health and physical manifestations of that stress 18, 24 months after the stressful event. So I would love to tell all of you that we're through the worst of it, but we're not. We're going to continue to see this continue to be a problem for the next little bit. And it leads to some of the things that we've talked about, including some of the turnover issues and just the feelings of isolation that people have, particularly in the way we've managed the pandemic, and trying to think about how they balance their work and life, which is increasingly hard for all of our employees. They're going home after a long shift and then having to be a high school teacher and figure out how to help their children in a unique education environment. And then when they want to get away and relax, they turn on the news, and what do they see? Political strife and social turmoil and uncertainty that have been plaguing us all. And so it's hard to escape here in the moment. And it takes a huge impact. So as we think about what we are seeing at MaineHealth, we're seeing it follow the national trends with significant amounts of burnout, the increase in the job stress, and a huge impact on job satisfaction, where people aren't able to really focus and feel connected emotionally to the job that they're doing in the moment, which is so important to all of us in healthcare, which is why this is such an important thing for us. And from a business standpoint, it's massive too. When you think about what it takes to replace someone who ultimately decides to leave the workforce for us, it's a huge, huge impact. You can see what the costs of a physician is, and you think about the time to find somebody who to replace them is a big ordeal. And that's the impact to our business just internally. It doesn't really take into account the impact to those patients whose care is disrupted, who have then developed a different relationship with us in the future. And so it's a big, big, big deal for us. And then you can see, as I mentioned below, the short-term disability claims have risen significantly in the last 2.5 years, which again goes back to just the physical impact of all of the stress and turnover. So I want to be clear that taking care of our employees, those people who care for our business, those people who care for our customers and patients, it is just the right thing to do. We owe it to them to be there for them in these moments, given all of the times that they are there for us in order to support our businesses. But at the same time, there's a good business case to be made for this. And so it is something that is top of mind for us as an organization. So we've established peer support groups. And again, part of that is to help normalize this in the culture, to where you have people who you can relate to, who you can talk to about this, and find out for many that they're not alone, that others are going through the same thing. And this is not a weird something. This is not anything that you're going to get in trouble for. This is not something that you should suffer with, and certainly not suffer alone. We've focused on expanding our medical group provider support program. And so this was launched originally to deal with the issue of physician burnout, which is another epidemic that we're dealing with in our industry. But to be sure, it is difficult for anyone to explain to me where that threshold is between burnout and stress and depression and post-trauma. All of them are so incredibly related. And so, as a colleague of mine said recently, part of the reason we continue to talk about physician burnout is because at times we're not courageous enough to talk about physician mental illness, because it's certainly increasing in the environment that we see. And then we're investing in employee well-being programs, and that includes additional benefits that are more traditional along what we tend to offer our employees annually, although more of them at no additional cost to our employees. We're also specifically investing over $2 million in expanding on-site behavioral health resources through the use of psychologists, social workers, and other counselors to be available at the workplace to help our employees who are suffering from the effects of mental health during the stress that we're all feeling in the moment. So I'll turn it back to Swapnil.
Thank you, Andy. Appreciate it. We are in the last section of our program prior to Q&A here around setting a behavioral health strategy. And the headline here really is that what worked 18 months ago is not going to work anymore. As we look ahead, a lot has happened over the last 18 months. We are in a different reality now. And as employers, as companies, think about how to evolve the behavioral health strategy, there is actually a lot of new learning to happen. And some of these tenets that I have listed here may seem on the surface quite trivial, but there is a lot of unpacking to do, which some of that we will start today, and we can go through as we go through the rest of the program. First one, listening to your employees sounds very basic, very simple. There are two kinds that I would highlight here. There is a lot of research, a lot of data out there. Given the focus on mental health in recent months, the silver lining is that there has been a lot of research. And so there is so much to be learned, and we've heard about it from both of our presenters already. There's even more out there. It's important that the HR organizations, wellness organizations, frankly, even the business leaders at organizations familiarize themselves with what has been happening, how have employees been impacted by the pandemic and the other things that have been happening, and how does that extrapolate to our own organizations and what can we learn from there. Very important at the same time to listen to our own employees, whether that is through employee satisfaction surveys, focus groups, understand how the needs have evolved, how they have changed, what are they using, what are they not using, what resources are helpful, why are they helpful, and similarly, what's not helpful and why not. So listening to employees, very, very important. Evaluating whether our current infrastructure is going to continue to work and support our employees the way we need it to support going forward is important. Investing, and it's really investing in behavioral health solutions, so not just thinking of it as a check the box exercise, but really thinking about, okay, there are things that we can certainly do that are fairly low cost, et cetera, but understanding given the context, is that going to be enough? So how do we really invest in our employees' behavioral health? Thinking about employee needs as well as employer needs. Employee needs, three simple words: access, navigation, advocacy. They sound simple, but they're very far from being simple. Those are big, big problems that the industry is trying to solve right now. How do we increase access where we may have a shortage of suppliers, if you will? How do we make sure that the navigation is intuitive and friction-free for employees? We talked about earlier stigma being a huge issue. So in that context, really reducing friction to be able to access the right support is so important. Advocacy, how do we make sure that we're not bouncing employees between solutions, et cetera, with no sense of coordination? There isn't really that advocacy present for them. Employer needs equally important because we need to invest in this. That means that we do need to, we need help with things like destigmatization, utilization support. We need transparency around impact. So we need to work with our solution providers to really understand what is the data, what is beyond just aggregate utilization numbers. Are people actually engaging with the solution? How are they engaging? Can we get more granular information, of course, while preserving privacy, confidentiality of employees, so we can inform our strategies with that information. And last but not the least, everyone has already talked about this, but over-investing in creating a culture of openness and support, not enough can be said about that. This is an example of when we talk about listen to employees, and there's a lot of data available out there. I selected this particular example because it essentially is hopefully as alarming to everyone here as it was to me. Millennials have been most impacted by the pandemic. If you look at our current demographic or of our current employer landscape, that's the population that is most represented. The second one that you see there, not far behind, is Gen Z. they are the ones who are entering the working population soon, and some of them have entered it already. So really thinking about the level of need that we have and evaluating what we have today, is that actually inclusive of those needs or not? The next slide here just essentially talks about that. I mentioned the infrastructure. The one that we have in place today, is that going to be relevant? A lot has happened over the last 18 months. COVID, social justice challenges, wildfires, extreme weather, extreme politicization of pretty much any topic. We have gone through a lot as a country, as a world. And that has resulted in, and this is not by any means comprehensive, but ones that we are highlighting here are lots of economic stress as well as emotional stress that's often related, but it could also be unrelated. If you think about when we talk about stress with the remote work scenario that has unfolded over the last few years, along with all of the pandemic restrictions, a lot of folks found their support system completely shaken. And when you think about that, put that in the context of working parents or folks who have elderly relatives, loved ones that they're taking care of, and now you add the pandemic restriction, it's unprecedented times that we are emerging from. So that essentially paints the picture of the need for which our behavioral health strategies need to now account for. There is, however, a silver lining, in a little bit of a silver lining in all of this. One of them is that human touch does not have to mean in-person touch. So that means that when we are thinking about our solutions, policies, et cetera, we really, need to start thinking about the digital solutions within that. And a lot of innovation has happened over the last few months that has really made it possible for us to now look at things like digital cognitive behavioral therapy tools that are out there, digital therapeutics that have proven outcomes that can be utilized in different settings. Now, there's no one-size-fits-all answer for sure, but those should be part of the solution as we think about different levels of stress on that mental health spectrum that our employees might be facing on a daily basis. What those digital solutions also allow us to do are, it does not solve the problem of access 100%, but it gets us closer to it, because now you can take advantage of things like optimizing across zip codes, across geography, and you can do a little bit better supply-demand matching as a result of that. You can also address needs that are different based on preferences of folks. So there are individuals who would rather engage with mental health support in bite-sized 10-minute increments versus having an hour-long session. You're now able to address that with digital solutions, with virtual solutions. And it further helps reduce that friction. So if you think about in a remote work setup, you may have employees who are not really near an urban center, who may not be near a hospital or a clinic where they can go and get help. You're now able to bring them that help more easy. So there's a lot of positive innovation that has happened, and it's not new necessarily, but with the constraints of the pandemic, it has just become more acceptable, and more credibility, if you will, has been established around these solutions that is now provided an opportunity for us to take advantage of those. So with that, in summary, as we think about behavioral health strategy, there are a few things that we have to be considering and solving for. We have to think beyond the office. In many contexts, we still need things like on-site solutions. They're very critical and important, but you have to question, are they enough? Do we need to do more than just that? Availability is not enough, which all that to say that it's so important that we do have the resources, et cetera, but we cannot stop there. We do have to invest in communication campaigns, destigmatization. How are we making it easy for our employees to actually access those solutions? User-centered design is critical. If you think about our employees, they're employees for us, but they're also individuals, they're consumers. They are engaging with apps and experiences that are very consumer-centric. We have to make sure we partner with solutions that are keeping that in mind, the mental health experience, or mental health support experience, I should say, should be equally engaging, if not more. We have a higher bar. What we are trying to accomplish is, one could argue, a lot nobler. So we need to even have a higher bar on making sure that that experience is engaging, that experience is friction-free for employees, and they want to utilize these solutions and resources. Making it intuitive, again, there's a theme here. How do we make it easy for people to use and engage with these? So we have to make it intuitive. There are a lot of companies out there that will put many solutions for their employees because they care, and they should. Where it often will fall short is it actually creates a lot of burden for the employees because they need to figure out which solution is right for me, and a lot of times any barrier will prevent people from seeking the help. So how do we really translate all of those great benefits we offer and put some navigation and guidance around it so folks go to a one-stop shop experience? And then last but not the least at all, holding the solution accountable. We have to demand transparency and data to really help us understand what is working, what is not at the next level. So it's not just, here's your overall utilization, but we really need to actually understand, okay, can I get by department cuts of where is a solution being utilized versus not? Can I understand the actual clinical outcomes? And perhaps we are not very close to that yet because I haven't frankly seen a solution do this well, but could we actually start to relate business outcomes with mental health support? So causation is, of course, very difficult to prove there, but can we actually make the case for we need to provide mental health support for employees, and it's not just a cost category that gets impacted anymore. It's actually a top-line problem as well. As an example, I would share, imagine a customer service department at your organization, and if we have even 30% of our customer service representatives or less not fully present, either absent or present but not engaged, and they are then delivering service to their customers, that gets impacted. That could be a retention problem, perhaps. So it's not just a cost problem, it is a top-line problem. And what Andy shared, it is a business problem. It's not just the right thing to do. It's, of course, the right thing to do, but there is a business case here as well. And finally, I will not spend too much time on this because I feel that we have covered this well and truly, but it's just so important that perhaps for the last time, really making space for vulnerability. Stigma is real, it's important, and how do we make sure that as we think about our strategy, we often will do a great job on setting the right policies, processes, solutions in place, but how do we also make sure that the culture that we're creating supports utilization of all of those policies, procedures, solutions, et cetera? And there are a few examples here that we share around. Maybe the one that I will highlight is that there is actually training and education available, resources available out there that can really equip our executives, our leaders, our managers, our employees to be much more comfortable with talking about mental health in the workplace. And it doesn't always have to only be role models who have had let's say a diagnosed depressive disorder or something like that. You can have normal levels of stress, still utilize your mental health resources and talk about it. And that's when I think we start to move the needle, when folks start to realize it's not just for the 20%, it's for 100% of folks out there. And so with that, I will hand it off back to you, Mike, for Q&A.
SHRM thanks Unum for sponsoring this program and SHRM's series of free webcasts. Unum is a leading provider of employee benefits that has, for over 170 years, been helping millions of people protect their families, their finances, and their futures. Unum delivers better ways to access disability, life, accident, critical illness, dental, and vision benefits through the workplace. Unum's award-winning leave and absence solutions help employers streamline absence management while making it easy and engaging for employees to plan leaves, receive benefits, and return to work smoothly. For more information, visit unum.com. Let's turn to some of the questions that are coming in. We'll start here. I think it's maybe for Dr. Mueller. How did you prioritize the investment to expand mental health supports for your employees as medical organizations? Actually, let me read that again. How did you prioritize the investment to expand medical health supports for your employees as medical organizations have faced a tough economic environment and tightening budgets?
Yeah, that's a great question. As I mentioned before, I see a real business case for this because of the huge impact of turnover in our workforce right now. As an industry, we have a turnover rate that's approaching 15%, and in some ways, that's even less sustainable than the financial predicament that we have found ourselves in collectively. And so we've got to do things to try to prevent that. And one of the ways is by investing in our team and our people and really showing that we care. And this is certainly something that so many are impacted by and facing in the moment. And I'll tell you, when we sort of had the aha moment on making this investment, we had already finished and closed our budget. We have a fiscal calendar year. Federal fiscal calendar year. And so we had already closed our budget for this year. And when the proposal was on the table, I looked at my CFO and he just nodded his head, yes, we're going to do this because it is absolutely the right thing to do, not only in terms of just doing the right thing to care about our people, but as I mentioned before, from a business perspective, we believe that we'll see a return in terms of decreased turnover, increased productivity, and certainly enhanced goodwill with our team.
This question for Dr. Evans. In your comments, you described critical components of a psychologically healthy workplace. Can you talk more about what being intentional about these different factors looks like in real life?
Yes. We talk about these as domains that we have to pay attention to as opposed to very specific things in each one of these areas. And the reason that we do that is because workplaces are different. A manufacturing organization is different than an organization that's primarily office-based, and is different than an organization where their people might be out in the field. But the principle or the concept is important. So take, for example, the importance of employee engagement. That's highly related to having a more psychologically healthy workplace. Well, what we do at the American Psychological Association to engage our employees is going to look different than other organizations. The point is we need to pay attention to that. In our own case, for example, we've done a range of things, from things that have been more symbolic to things that are very consequential. An example of that is something towards the more symbolic part of the continuum. When I came to the organization, our all-hands meeting was primarily the CEO talking to the workforce for probably about 75% of the all-hands meeting. Today, I talk about 10%, and the staff actually put together the program. They identify the issues that we should be talking about. They do most of the presentations, and I think it's a visible recognition of their input and involvement in helping the organization. At the other end of the continuum, on questions that are much more consequential, like the extent to which we will be virtual and what will that look like in our organization. Again, we're being very intentional about making sure that we have employee input. What I've said to my staff, for example, is that the decisions that we've made at this point is that we will be more virtual. That is absolutely something that we know. Now, what that looks like, what our policies are, what physical changes we need to make to the building, the employees are going to have input on that and those decisions. So I think each of us has to think about how these issues play out in their own organizations and then develop interventions that speak to, and in this case, engage their employees. But it's the same thing when it comes to health and safety issues, when it comes to those other domains that I talked about.
Again, for Dr. Evans, many organizations right now are focused on promoting equity, diversity, and inclusion in their workplaces. Can you talk about the role of EDI in fostering and maintaining a psychologically healthy workplace?
Well, I think, and this is the way I think as a CEO, I think that organizations should not engage in EDI efforts unless they can connect it to their mission. Now, I happen to believe that these issues are, and we know from the research that these issues are very connected to the mission. We have lots of different dimensions of diversity within our organizations, and we know that historically that those dimensions can also reflect groups that are have less access or less included, et cetera, within the work environment. And we know that when employees feel that way, when they feel that there are these inequities, that it has consequences for not only the individual, but the organization. I shared data earlier that one of the groups that was looking more at leaving the organizations were people who experienced discrimination within the workplace. So it's really important then, and to Dr. Mueller's point earlier, that these are not only good issues to, the right thing to do, but there's a very strong business case that organizations that address these issues are going to have a competitive edge. And I want to give a really quick example. If you ever go to a car dealership, one of the things you'll notice is that they have a very diverse sales force. And they do that because they want to sell cars. And they know that one of the ways that they can be more effective at selling cars is to make sure that everyone that walks through the door can find someone that they can relate to. So it's it's much easier to connect the dots in that case, but you can make the case in all of the different areas that we have, that our organizations work in, that there is a strong case for addressing, identifying these issues, addressing them, and then really making them a part of how the organization operates to not only help the employees, but to give them that competitive edge.
Continuing with our audience questions for Ms. Prabha. You mentioned culture being key. Can you talk through some of the most important role modeling behaviors leadership can put into practice?
Sure. I think when it comes to, there's so much that we can do as leaders to set the right precedents and culture in place. I think one that comes to mind immediately is vulnerability. How do we make sure that as leaders we are not afraid to be vulnerable? So sharing experiences, not being afraid to ask questions, etc., is important. However, I also do think that if we are going to expect our leaders to do that, it is important to provide the right training, etc. So I'll just share an example. At Unum, we are making 2 types of trainings available for everyone from C-level to line managers to influencers in the organization. And one is executive education. That is 1 to 2 hour engagement, which talks about what are acceptable questions to ask. It's really practical. It really gets to the heart of how can you, without fear of offending someone, be there, be present for your teams, etc. And then the second one is mental health first aid at work training that many organizations offer that. We're using the National Council of Behavioral Health to provide that training for our employees at large, and folks have the ability to take advantage of that, and that is very much intended to, again, be to almost prepare you to be role models for your organization, for your colleagues and teams.
And this may be our last question again for Ms. Prabha. Audience member asks, what kind of KPIs are most important when analyzing the strengths and weaknesses of our mental health strategy?
This is a near and dear to my heart question. I can probably talk for an hour on this, but I think that there are different levels. So there is the table stakes, which means utilization, but not at an aggregate level, but at a granular level, so you can really understand what parts of the organization are using solutions versus not. Engagement level, which is a little bit, in my mind at least, different from utilization, which is to say, how are people using the solution? So can we actually understand, and this, by the way, is a huge benefit of digital solutions, but also in EAP settings, you can certainly understand what type of service folks are using. So not just that someone used the EAP solution and that gets a check mark, but what service did they actually use? How many sessions did they engage in? So it's not just the yes or no utilization, but also the level of engagement. And then I would add, and a lot of solutions are beginning to offer this, which is clinical outcomes improvement. So did folks who went through a particular treatment see improvement that can be clinically proven and measured? And then relating that to productivity. So there are data sources out there or survey mechanisms out there like the WPAI, et cetera, that you can actually survey your employee population, understand the impact of mental health challenges on their work and home lives, and then by cohort, look at, are they utilizing the support, et cetera? Are they seeing clinical improvements? And as a result, when you resurvey them, are they actually showing improvement in the impact that they have? So I think the closer we can get to relating our investments in mental health to business outcomes, to productivity, the more impactful that becomes for a strategist to be able to then go to the CFO and make the case, this is why I need to invest in this. And it's an easier conversation, perhaps, for a CHRO to have with the CFO than just to essentially say that, hey, I know there are a lot of cost pressures, but this is the right thing to do, and we need to do it. So just cognizant of that we have to prove the ROI and the business case when it comes to data.
All right, thank you. With that question and answer, we are going to start bringing today's webcast to a close. Before we sign off, SHRM wants to thank Dr. Arthur C. Evans from the American Psychological Association, Dr. Andrew T. Mueller from MaineHealth, and Swapnil Prabha from Unum for the insights and information they've shared today. And we also want to thank everyone tuning in for being with us and for choosing SHRM for HR webcast. That concludes this program.